Welcome to the second section of our course, where we explore program management and administration. In this lesson, you will learn how healthcare organizations turn complex privacy laws into everyday operational practices. This topic is incredibly important, because having rules on paper means nothing without real people and processes to enforce them. We are going to cover everything from the specific roles of compliance officers to the creation of effective workforce training programs. Get ready to discover how to build and manage a robust privacy and security program from the ground up, as this knowledge is crucial for your success on the certification exam. To help reinforce these foundational concepts as we go, I highly recommend obtaining our practice tests or the offline app, which are fantastic educational tools to test your knowledge. The HIPAA privacy rule specifically requires every covered entity to designate a privacy official. In the industry, this person is most commonly known as the privacy officer. This is not just an honorary title, but a highly active role responsible for developing and implementing the organization's privacy policies and procedures. The privacy officer acts as the central point of contact for receiving patient complaints and answering internal questions about health information sharing. On the exam, remember that having a designated privacy officer is not optional. It is a strict legal requirement for any organization handling protected health information. Just as the privacy rule requires a privacy officer, the HIPAA security rule mandates the designation of a security officer. While the privacy officer focuses on patient rights and general information sharing, the security officer is deeply focused on the technical protection of electronic health records. They manage the technical, physical, and administrative safeguards that keep computer networks safe from hackers and internal threats. In smaller clinics, one person might hold both titles. But in large hospital systems, these are usually two distinct roles. The exam will test your understanding that these two leaders must constantly collaborate to keep the organization compliant. The foundation of any strong compliance program is a comprehensive set of written policies and procedures. Policies dictate what the organization intends to do, while procedures provide the exact, step-by-step instructions on how employees should do it. For example, a policy might state that all patient data must be securely destroyed, and the procedure will explain exactly which shredding bins to use and who empties them. These documents ensure that everyone in the hospital follows the same standardized rules. For your exam, you must know that verbal rules are never enough, as auditors will always ask to see your formal written policies. Policies and procedures are never meant to be written once and then forgotten on a dusty shelf. They have an active life cycle and must be reviewed and updated regularly, typically on an annual basis. Furthermore, whenever there is a major change in the law, a significant shift in technology, or an internal environmental change, the policies must be updated immediately. If an exam question mentions a hospital installing a brand new electronic health record system, the correct answer will almost always involve updating the security policies. Keeping documentation current is a major administrative responsibility tested on the exam. A critical administrative requirement is the creation and enforcement of a strict sanction policy. A sanction policy outlines the specific disciplinary actions that will be taken against workforce members who violate privacy and security rules. These punishments can range from a simple verbal warning for a minor mistake to immediate termination for deliberately stealing patient data. The most important concept to remember for the exam is that sanctions must be applied consistently across the entire organization. A top-earning surgeon must face the exact same discipline for a privacy violation as a newly hired medical assistant. You cannot expect employees to follow the rules if they do not know what the rules are. Which brings us to workforce training. AHIMA mandates that all new employees receive privacy and security training within a reasonable time after they are hired. In addition to onboarding training, organizations must provide periodic refresher training to all staff to keep security top of mind. This training must cover basic security awareness, recognizing phishing emails, and understanding how to protect passwords. Exam questions frequently highlight training as the primary administrative safeguard against human error. When designing a training program, one size does not fit all, and the exam will expect you to understand role-based training. Role-based training means that the education provided must be specifically tailored to the duties of the employee. A receptionist needs intense training on how to verify patient identities at the front desk, while an IT administrator needs training on securing database servers. Providing generic training to everyone is considered ineffective program management. Always choose exam answers that emphasize customizing the training curriculum to fit the specific access levels and daily tasks of the workforce member. To see how these role-based scenarios are actually tested, utilizing the practice tests or our offline app can be incredibly helpful for your study routine. In the world of healthcare compliance, if it is not documented, it did not happen. This famous saying applies heavily to program administration, especially regarding training records and policy acknowledgements. The Privacy Office must maintain detailed logs showing exactly who was trained, what topics were covered, and the date the training occurred. Employees should also sign documents acknowledging they have read and understood the organization's privacy policies. For the exam, you must memorize that AHIMA requires all compliance documentation, including these training logs, to be retained for exactly 6 years from the date of its creation or the date it was last in effect. Effective program management requires active auditing and monitoring of your electronic systems. Auditing is a proactive process where the privacy or security officer reviews system access logs to see exactly who is looking at patient records. The goal is to catch inappropriate behavior, such as a nurse looking at the medical chart of a high-profile celebrity or a family member, when they have no treatment relationship with them. Exam scenarios will often describe a situation where employee snooping is suspected, and the correct administrative response is to immediately pull and review the electronic audit trails. Managing external vendors is a major administrative challenge that falls under the Privacy Office. As we learned in the first section, organizations must have business associate agreements in place. But administration goes far beyond just signing a paper. A well-managed program will maintain a detailed, centralized inventory of every single business associate the hospital uses. Furthermore, the Privacy Office should periodically audit these vendors to ensure they are actually following the security measures they promised in the contract. Vendor risk management is a growing focus on the CHPS exam due to the high number of data breaches caused by third parties. Every healthcare organization must establish a formal, Documented process for receiving and handling privacy complaints. Patients must have a clear and easy way to report their concerns, such as a dedicated phone hotline or a specific email address managed by the Privacy Office. Staff members also need a secure internal channel to report suspected security incidents or policy violations observed in the workplace. Providing a simple mechanism to hear these concerns allows the organization to identify and fix small vulnerabilities before they turn into massive data breaches. The exam tests your ability to recognize a well-structured complaint process. Hand in hand with the complaint process is the absolute necessity of a non-retaliation policy. A non-retaliation policy, often called whistleblower protection, guarantees that employees will not be fired, demoted, or punished in any way for reporting a compliance violation in good faith. If staff members are afraid of losing their jobs, they will simply hide security incidents, which puts the entire organization in massive danger. Exam questions will test your understanding that fostering a safe environment for reporting is a mandatory administrative safeguard and a core duty of the privacy officer. Program administration also involves preparing for the worst-case scenarios through contingency planning. Contingency planning ensures that the healthcare organization can continue to operate and protect health information during an emergency, such as a natural disaster, a massive power outage, or a cyber attack. The administrative team must develop policies that outline how to back up data, how to restore systems, and how to treat patients using paper records if the computers go down. The CHPS exam will verify that you understand contingency planning is a mandatory administrative requirement designed to ensure continuous patient care and data availability. A modern compliance officer must also understand the principles of data governance. Data governance is the high-level management of the availability, usability, integrity, and security of the data employed in an enterprise. It means knowing exactly what patient data you collect, where it lives on your network, who owns it, and when it should be securely destroyed. You cannot protect data if you do not know you have it. Exam questions on data governance often focus on the administrative policies required to track the entire life cycle of electronic health information from creation to final deletion. One of the ultimate goals of program management is establishing a strong culture of compliance within the organization. A culture of compliance means that protecting patient data is not just seen as the privacy office's job, but as a core value shared by every single employee. This culture must start at the very top, with visible support and funding from the board of directors and executive leadership. When the executives take security seriously, the staff will take it seriously as well. For the exam, recognize that a top-down leadership approach is the most effective way to manage an organizational compliance program. To actually build this culture and manage these tasks, the privacy and security offices must be given appropriate resources. An organization cannot simply name someone the privacy officer and then deny them the budget needed to buy secure software or hire training staff. The exam will expect you to know that executive management is responsible for allocating adequate financial and human resources to the compliance program. If an exam scenario describes a privacy officer who cannot perform their duties because they lack funding, the root administrative failure lies with the organization's executive leadership. Because the executive board is ultimately responsible for the organization, the privacy and security offices must provide them with regular reports. These reports should include metrics such as the number of privacy complaints received, the results of recent security audits, and the completion rates of employee training. By presenting this data, the officers keep the leadership informed about the organization's risk level and justify the need for continued budget and resources. Test questions will verify that you understand this reporting structure, as keeping the board informed is a critical administrative function. Finally, program administration plays a vital role during periods of organizational change. If a hospital decides to merge with another clinic, buy a new medical practice, or adopt a new cloud-based software system, the privacy and security offices must be involved from the very beginning. They must conduct due diligence to ensure the new acquisition does not introduce massive security risks into the existing network. The CHPS exam frequently uses merger and acquisition scenarios to test if you know how to apply administrative oversight during major business transitions. Congratulations on finishing the second section of this exam preparation course. You now have a comprehensive understanding of how privacy and security programs are managed, staffed, and administered in the real world. To lock in these important administrative concepts, I strongly encourage you to complete the attached practice tests right now, or explore our offline app to continue reviewing on the go. Working through practice questions will dramatically improve your long-term retention and ensure you are comfortable with the exam's unique question style. The practice tests and offline app are included with this lesson to help you practice active learning immediately and effectively. Keep up this fantastic effort as we move naturally into our next crucial topic: environmental assessment and risk management.